Hi, my name is Pamela Smith and I'm a PhD researcher at the School of Medicine, Cardiff University, and I'm based in the Division of Population Medicine. And today I'm going to be giving you a bit of an overview of health psychology, so a real whistle-stop tour of a very broad and large area of work. But we're going to have a little look at what it is, where it is, and why. So firstly, a bit of an overview of the presentation I'm going to give. We're going to firstly look at a bit of background information. Then we're going to look at the what, who, why of health psychology. Then I'm going to focus on some of the research that we do in our team at the Division of Population Medicine. And then I'll end with some summary and resources that you might want to visit or explore and find out a bit more about health psychology. So firstly, a bit of background. The field of health psychology emerged in the late 1970s as a way to address rapidly changing field of healthcare. So life expectancy back then was much lower due to a lack of basic sanitation and high levels of infectious diseases. However, life expectancy today is much higher, and it's around 80 years. And the leading causes of death and chronic diseases are actually often linked to a lot of lifestyle choices that we have. So health psychology helps to address these changes in health and ultimately improve mortality rates and lifestyle to better our health and well-being. So, for example, for years we've known about the dangers of smoking, and we've known that we should eat less and move more. But in the end, what motivates us to put down the donut and hit the running trail or carefully follow up a doctor's instructions about medication? Health psychology explores these motivations in the pursuit of getting people to embrace health promotion and preventing an illness. And this speciality area examines our biology, our society, and our psychology that influence the choices we make about our health. So, health psychology is defined as an area of psychology that focuses on how biological, social, and psychological factors influence our overall health and well-being, and specifically the interactive kind of nature of behavioural and psychological variables to promote healthier lifestyles and illness. And we'll go into some of those examples in a minute. But just going back to this kind of biological, psychological, and social factors, the main approach that's used in health psychology is something called the biopsychosocial model. And according to this view, illness and health are the results of a combination of our biology, our psychology, and our social factors. When we talk about biology, we're looking at kind of inherited personality traits and genetic conditions. When we talk about psychological factors, this kind of involves lifestyle, personality characteristics, and stress levels. And social factors could include things such as social support systems, so our family and the relationships we have, as well as those cultural beliefs that will obviously differ from culture to culture. So who is a health psychologist? Well, health psychologists study the factors that allow people to be healthy and recover from illness or cope with a chronic condition, as we mentioned. And they're experts in the intersection of health and behaviour. And they're really in demand as a part of integrated health care teams. So they're working with other doctors to provide a whole person healthcare. It's a rapidly growing field of work. And as increasing numbers of people seek to take control of their own health, more and more people are seeking health-related information and resources. So health psychologists are really focused on educating people about their own health and well-being. And so they really fit perfectly for this rise in demand that we're seeing over people wanting to take control over their health. So, health psychologists work with individuals, groups, and communities to decrease factors, improve health, and reduce illness. They conduct research and provide services in areas including, but not all, stress reduction, weight management, smoking cessation, improving daily nutrition, and reducing risky sexual behaviours. So they work across a range of healthcare and other providers, and the settings can vary from kind of large-scale public health programs to more individual and smaller group consultations. So I'm going to give you a couple of minutes to pause the video now and have a think about other areas in which health psychology could be used. So now you've had a bit of time to think about other areas. I think it's really important that I kind of let you know of some other settings. So health psychologists can often be in hospitals and community settings, and private healthcare, be a private healthcare provider as well. But for the focus of the rest of this presentation, we're going to look at health psychology within the field of academia, so academic organisations and research. So I'm part of the cancer screening, prevention and early diagnosis team that's based in the Division of Population Medicine at Cardiff University. And a lot of our research is aimed at increasing understanding of the influences on cancer risk and prevention, looking at improving early symptom diagnosis and encouraging people to go for their screening or go to a doctor. And for today's presentation, I'll just be talking about the work that we've done within the area of mainly lung cancer, although we do have a specific expertise in colorectal cancer as well. So we use behavioural science to develop and test interventions. But firstly, what is an intervention? So the kind of technical definition is an intervention is a combination of program elements or strategies that are designed to produce behaviour changes or improve health status among individuals or an entire population. So interventions are everywhere, and they're basically a program that is created and developed and often backed up by a lot of research that can help make a change. And in this area of health psychology and the work we do within our team is looking at making a change in cancer screening, prevention and early diagnosis. So we want to positively improve screening, prevention and early diagnosis. Our team and collaborations have specific kind of interests in supporting early diagnosis and understanding early diagnosis and improving screening outcomes, particularly among high-risk groups, with a focus on reducing inequalities in deprived groups or deprived communities. So I'm going to hand over to Grace now, who's one of my colleagues in the Division of Population Medicine and in the Cancer Screening and Prevention Early Diagnosis team. And she'll give you a little bit of an overview of some of the really interesting work that she's done.
Hi, my name is Dr. Grace McCutcheon, and I'm a research health psychologist working at Cardiff University in cancer research. This short video will tell you a little bit more about my research. So we know that early diagnosis of cancer is really important. So I work on projects to understand why people do or don't go to the doctor with symptoms of cancer. Then I think of ways to encourage them to go early and overcome these barriers. I also work on studies about cancer prevention. So I look at ways that we can support people to stop smoking. So all of my research focuses on lung cancer and in the groups of people where lung cancer is most common. This is because at the moment, lung cancer outcomes are really poor. But this can change because we know that if lung cancer is diagnosed early, it is more likely to be cured. So through my research, I work with patients, the public and healthcare professionals to develop ways to empower patients to engage in early lung cancer detection. I really enjoy this aspect of my work, especially when you feel like you've made a difference to people's lives. It is my ambition to take what I've been doing in the UK out into a more global scale. So with help, support and funding, we can make that possible.
Thanks, Grace. So some other work that we've done within our team that is health kind of psychology driven and has an underlying presence of health psychology is the Abacus study. And this is looking at the awareness and beliefs about cancer. So evidence has shown that cancer survival rates are lower in disadvantaged communities, and this could possibly be due to awareness of symptoms and delayed help seeking. And it's really important that people increase their knowledge of cancer symptoms so that it can be detected earlier and improve their treatment outcomes. Abacus included an interactive online questionnaire that was delivered by a trained health advisor who you can see in the blue t-shirt on the right. And in completing the questionnaire, the individual was asked a total of 29 questions that covered information on their background, lifestyle, and health. And they're provided with a summary page which color codes their responses using a traffic light system, so red, amber, and green, to highlight areas where action or advice should be taken. Some of my research within the team and my PhD is looking at the gaps in stop smoking interventions for older deprived smokers and factors that are linked to motivation to stop smoking, such as confidence. These can support to help quit smoking and health issues that may impact someone's ability to stop smoking. And overall, my findings have shown that stop smoking interventions might need to be tailored to suit these needs of older, deprived smokers. So we need an intervention that can target this demographic that has the ability to engage smoking cessation in those that might not be highly motivated to quit, but still remain at high risk of lung cancer. And there are a lot of other factors that influence a person's smoking and quit attempts within this population of older deprived smokers, including social isolation, so not seeing many people, and also real lack of social support. And these are really important things I'm thinking about when we're looking at developing an intervention for this population. And finally, a really interesting piece of work that's currently being conducted in the team and being led by Professor Kate Brain is the COVID health and help-seeking behaviour study. So the study is there to measure cancer attitudes and behaviours in adults who are aged 18 across the UK. And this is because during the pandemic, people may not be aware of the importance of seeking early medical help for signs of cancer or taking up screening when available, as in a way to diagnose cancer sooner. In addition, some people might not want to be referred to a hospital due to fear of catching coronavirus in the healthcare setting. And COVID-19 may also affect whether people take part in healthy behaviours that reduce the chances of getting cancer. And these factors can lead to more cancers occurring and more cancers being diagnosed at a later stage when treatment might be less successful. So what does the study involve? This study is taking place over 18 months, and it will be a large study to measure cancer attitudes and behaviours in adults across the UK. It aims to include adults from a range of different backgrounds, including those from disadvantaged communities and Black, Asian or minority ethnic groups. The study will be used to rapidly develop public health messages as a way to encourage people to act on the early signs of cancer, take up cancer screening when it becomes available, and engage in healthy behaviours. And we really think that this will help to reduce the negative impact of COVID-19 on cancer outcomes in the long term. So a really important piece of research, which is being led by Professor Kate Brain, who is a health psychologist within our team. So just to sum up, beliefs and behaviours can influence whether a person becomes ill in the first place, whether they seek help, and how they adjust to their illness. Health psychology research helps to understand these psychological factors that influence health and constructively apply that knowledge. Furthermore, health psychologists can improve their health by working directly with individual patients or indirectly in large-scale public health programs and research. Some of the research that I've just mentioned, for example. So if you would like to find out a bit more about health psychology, you could always check out the American Psychological Association, where they have some free samples of articles or head to the British Psychological Society Division of Health Psychology website, where you can read more about health psychology and its implications. Thank you so much for listening to me today, and I hope you enjoy the rest of your day. Bye.